Hi, my name is Lakeisha. I'm talking to the patient and I got a doctor's order to put in a Foley catheter. And I explained to the patient and I did 2 identifiers, date of birth and the name. The patient understands what's going on. I have my sterile field here and I'm going to use patient and I got a flat surface. First, I wash my hands. I put on, which we can do 1-inch margins, so I can take my finger to the 1-inch margin of this and I can pull it that way, away from me. Then the other 2 sides is non-sterile, so I can take 1 inch on one side, open up, 1 inch on the other side, one inch, okay, and then the last one is 1 inch. One-inch margins on each side, not sterile, so we can pull them back. Now I take my gloves on the outside. I should be able to see. And this is above my waist to be sterile. Move so you can see my gloves. Okay, so I take the flaps, open it up, and take at the 1 inch margins underneath. I take my fingers underneath to open up the packet. Open up the gloves. Then I take my finger and I put it underneath the gloves to put them on. And this my hand, but I'm gonna put this on. Barely can put this on, but I got trying to put this on, which have broken fingers, but put on sterile gloves. Alright, now I'll take this one underneath, you gotta pull it up. Now I'm taking my 1 inch margin on these gloves, and I'm darning this glove on this hand. Now, I'm going to save this paper here for my trash. So I will throw it in the trash. It'll be on this paper, which is my trash. Okay. Now, I'm trying to get back to here. Okay. Now, we're going to take this paper. This is, they say the shiny side goes down. This is the shiny side. So 1 inch on both sides. You take and hold it on 1 inch. Both sides. And I have to have they say now it's 2 people to do this. Which right now, I'm gonna do it with me. So I'm gonna put the shiny side down. Okay, so in the sterile area. Now I have the cover for the patient. We're going to cover the patient with this piece right here over where the private area is. Okay. Now, I'm going to get my betadine, which first you're supposed to ask, are you allergic to betadine or are you allergic to latex gloves? And we've already verified all that, and they're not allergic to latex or betadine. So, we take our betadine, open it up. I'm gonna take this, I'm still in sterile field. Okay, move it over to the sterile area. I have 3 already. So this goes trash. I have 3 swabs. So the first swab, I swab on D. Put these in the tray. These going in this tray. Okay. Let's just see this. Everything is still sterile. Just move my camera so you can see. This is the labia. I'm going to the labia. The minor. We're going from the side. I'm going to swipe. We're cleansing the labia. Go down on one side. Throw away. Get another one. Another swab. Go on the other side. Go top to bottom on the side. Throw away. We're going in the center. Top to bottom. We're cleansing it. So before all this, I had already cleansed her area with soap and water and had other gloves on before we started doing this. So now, as soon as we get her all cleaned up, soap and water, then we're going to this sterile field. Okay, now I have the Foleycatheter. And I have my lubricant. Here's lubricant. So I have everything in my sterile field. I'm going to put the lubricant in the sterile field, so we can use it for the Foley to insert it easier. All right, throw this away. Okay. I have my syringe. Read the bulb and see how much normal saline, how much fluid of normal saline we put in the bulb. It says 5 to 10 mLs. It's a 14 French. It says start off at a small syringe, a small catheter first. So the 14. So I'm going to take this. Okay, and put this on here. They say you don't test the balloon now, because the balloon can change the shape. That I hear it changes the shape, so they don't test the bulb no more. So I have it connected to the Foley bag. And what we're going to do now is Foley's in the plastic. Okay, this is trash. Trash. Take this Foley part, tip, and dip it into the petroleum before we insert. I tell my patient what I'm getting ready to do, and I tell her to hold down like she's taking a bowel movement. And I take this hand, non-dominant, and I spread open her labia. I'm still on the sterile field. And we go into 1 to 2 inches until we get return of urine. We're going in, I get urine. Once I get urine, I go about 2 more inches. Okay. All right, still holding the labia. All right. Then I squeeze the bug. Give them 5 cc's. It says 5 to 10 ml, so I give them 5. Okay. Now it's in. Okay, it's in. So we take the bulb off. So now, this is a clip right here. This is to hold it to the sheet so you can stretch out the tube so it'll be, won't be kinked. But first, since it's in, we're gonna pull back some, making sure no tension. Don't wanna be no tension because you can pull the Foley out. So, no tension. Okay. We're going to take the bag out, and we're putting the bag on the surface, on the bed, on the side of the bed that does not move. Because if you put it on the side that does move, it will yank the Foley out. And we don't want to do that. Okay? So I put it down low enough to where it's beside the bed and anchored. Okay. Then I take this part. Well, I take my gloves off because we're going to use more gloves to do the rest. All right, it's the Foleycat is already in the person, so now I can put the sticker on. I'm gonna use more gloves. I like to use more gloves. After I put the Foley in with my sterile gloves, I like to change my gloves afterwards. Once I wash my hands, use my sanitizer, then put the gloves on. Then we're going to clean the patient's skin in the inner thigh with alcohol. It's no alcohol. With alcohol. Then we use a skin prep to get it clean on the inner thigh. Okay? And then I use the anchor, which is no anchor in here, but the anchor goes on this part right here, and we clamp it. And we clamp it to the inner thigh so it'll hold, secure it so it won't pull. And I tell my patient, we're done for now. Thank you.